Welcome to MAP, the bi-weekly market access podcast hosted by me, Dr. Stefan Walzer. I am the innovator of Market Access 4.0 and a health economist by training and working in the fields of market access, reimbursement, pricing, and health economics since 2004. Discover Market Access 4.0 and unveil the future with our innovative solutions. Max Insights, our fast and easy AI-based reimbursement planning platform. Dobo, our new revolutionizing way of creating reimbursement dossiers across the globe with the first and only dossier writing AI bot. Cubo, our new AI-based objection handling platform. And Waffle, train with Waffle's virtual reality genius in an immersive environment and with an AI-based counterpart. We are Market Access 4.0. So check out our website, marketaccess4-0.com. And now let's dive into the current discussions, processes, and trends in market access across the globe. Welcome to another episode of the Market Access podcast. Today, we have a special guest, at least special guest for me, Helmut Butscher. I mean, we work as well together on a couple of different projects in the meantime, and we always have had a lot of interesting and also deep discussions on the use of AI in market access, what also the topic is about for today. But before we jump into the details, I suggest, Helmut, please feel free to quickly introduce yourself that everybody knows you as well before we get into the content.
Thank you very much, Stefan, for this option to talk about AI in market access. I've been market access manager since 2009, and my role is an interim manager. I ensure that all aspects of market access operations and reimbursement issues run smoothly in companies. I support organizations by integrating market access strategies with AI, design thinking, and knowledge graphs that improve patient outcomes.
Perfect. Very good.
Shortly.
Yeah, perfect. No, I think that already shows that I think you're a perfect fit as well to the topic. And I think the idea for today is probably also a bit to, let's say, maybe discuss a bit, or maybe do a bit of a sense check as well, how well AI has already been implemented, or maybe at all, in the market access area. And of course, we will have a lot and big variety, a lot of heterogeneity between companies and even within companies, I presume. But maybe we can take that as a kind of, let's say, key pathway for our discussion. But before we maybe get into some of those details, I would be very interested, because I think you also see a lot of different companies, a lot of different impacts. And I know that you also prepared very well as well for the podcast. Where do you currently already see the impact of AI, a measurable impact, I mean, in market access? So, I mean, the field is wide, but where is it already gone beyond the hype, what we sometimes hear as well when we hear the buzzword AI?
Yeah, it's a very good question. AI is reshaping pricing, reimbursing market access in a quite but powerful ways. It accelerates evidence generation and reads real-world data at scale and predicts pricing and reimbursement outcomes with new clarity. And I think this is a very, very good point. A new clarity. We have another perspective on data. It streamlines workflows and supports smarter HDI preparation while reminding us that transparency, bias, and trust still matter. AI won't replace human judgment. This is a very important point for me. It amplifies it, and how we choose to use it will define the next decade of market access. And I think we have three issues. Firstly is the evidence generation, and secondly is pricing and reimbursement, And thirdly, and finally, operational efficiency. There we can go very deep in these cases. For example, evidence generation with systemic literature reviews and data extraction. This is a very important point for us for our daily work. And AI is already streamlining evidence generation by automating literature reviews and extracting relevant data from clinical notes and research articles. This reduces manual workload and accelerates the creation of evidence packages for the market access submissions. And the real-world evidence is with the AI tools, I think, are increasingly used to analyze real-world data from electronic health records, claims and patient registries. I think this is an improvement to generate real-world efficiency that informs payer and pricing decisions, especially in areas like oncology and chronic disease or rare disease. And secondly, the pricing and reimbursement. It's a pleasure to have AI for predictive modeling. You have the chance to pilot it to forecast pricing outcomes, simulate reimbursement scenarios, and optimize launch strategies. That's a very great support for me. And some health technology assessments agency, such as NICE in the UK, are open to AI-generated evidence if it is transparent and validated. Automated dossier creation is also automate the creation of HDI dossier and other submissions, materials. Reducing time. I think reducing time is for me a very good example of how the efficiency is for AI. And resource demands for internal teams. You have the option to get new ideas for the approval for the HDI submission, and maybe you have the chance to find new data gaps to interpret it for the authorities. And the third one is the operational efficiency. The workflow automation. AI is improving operational efficiency by automating repetitive tasks. Yes, the boring tasks, the repetitive tasks. Support decisions making and integrating predictive analytics into daily workflows.
Yeah, no, perfect. I think that's. This is giving a bit of a big frame. I have a couple of, let's say, points we can probably also discuss about it. The most evident one is probably, when we speak, I know, and when I follow you now, it sounds that all of those tools and platforms and however you want to use or let's say name it, softwares, are being used regularly by market access managers. Is that the case from your experience, or is it rather the opposite and maybe has a slow uptake or a normal uptake? I don't know. Anything you can shed a bit of light on that?
Yes. At the moment, I see that we in the market access field, we are very we could be very transparent. We have a high transparency, yeah? Mm-hmm. And there's another point is for me the regulatory acceptance. Yeah? Mm-hmm. And there we have, I think this is a dark hole for me because maybe they have a limited adoption key, pricing, reimbursement, market access, because they have a look on a new AI, but only a small fraction of HDI submissions currently incorporated AI-generated evidence. And regulatory bodies require high transparency. We have a high transparency, but where's the transparency from the regulatories? We don't know exactly. So sometimes we don't understand the decisions making from the regulatories at the moment, and the explainability is another challenge for us to show them that the regulatory, and if we have AI data. If we show AI data, I don't know how is the acceptance from the regulatory for these data.
But maybe we can quickly go one step back, right? The two things, right? One is transparency. Transparency is, of course, a bit of a question when we use AI suddenly. I think you also mentioned potential risks like hallucination and the like. So that's maybe as well something we would need to touch base on. So maybe the question is also how AI could influence the transparency what pharma maybe or industry currently has, which is one point. And then just the other part is then also maybe before it comes to acceptability of agencies, what is the acceptability of market access managers within the industry? Is everybody using it as of now, and we're now just having it January 26, or is it rather still a bit of a convincing steps maybe to be made, especially when also speaking with those market access managers? What is your opinion on those two things?
Yes, what's my experience since 2009? I'm in the market access field. It was a very new department, so you have always the fight in the companies against the marketing and commercial departments, and it was very interesting. In the last years, I see more acceptance of the market access managers in the companies, and they have they would like to have the commercial and sides would like to have a better understanding of the way of the reimbursement, the way of where the money is going through the healthcare system. This is very important for the decisions making. And normally, if you talk with the marketing expert, he said we have to do a lot of things with the field force to make a power in the market, yeah, and they don't have any perspective on the reimbursement sides, and they are sometimes very astonished about if you show them the regulatory framework for pricing in all over in Europe, yeah, and where the decisions are going on and where the decisions making is done, and this is very every day. This is my everyday experience of what I have. There's no sensitivity in the companies. What chances you have if you have a look very early on the reimbursement of the drugs, the approval of the drugs, and about the stakeholders which are included in all decisions making for prescription of the drugs generally. Yeah.
Yeah. Okay. Yeah. So it's. I mean, it has basically two components. One is the market access manager, or let's say the market access function itself, and the acceptability, which might vary as well between companies, I presume. And then the other one is the acceptability of AI within that kind of role.
Yeah.
So, I mean, I could imagine that, of course, AI can help shedding further light into the complex environment of market access and reimbursement, especially as, let's say, every country has its own system. But how sure, how certain can we be if we have an outcome by AI? And of course, I know that because we all know, we use, and I know you do that as well, use AI on various aspects. So it might heavily vary as well on the different kind of, let's say, questions and areas and platforms you use. But just generally, I mean, what is your feeling of, let's say, trusting AI outputs in the area of market access reimbursement, especially, and that's maybe as well an important consideration, what you said a bit earlier, when, for example, the decision-making rules or the underlying reasons for payer decisions are not, let's say, not always transparent. I mean, we know what the drivers are, but it's not 100% transparent.
Yeah, it's going to be. No. Yeah, it's a very good question. I'll give you an example. I have a story for this. Yes, imagine in a room, an HDI committee is gathered. Europe, US, never mind. On the table lies a dossier for a new therapy. Expensive, innovative, full of hope. And the decision is anything but simple. In this room, two voices are present. You can't see them, but everyone feels them. The first voice is the voice of utilitarianism, yeah? And it speaks calmly, analytically, almost mathematically. And we must do what brings the greatest benefits to the greatest number of patients. Look at the qualities, look at the either of resources are limited, so we must use them efficiently. Yeah. This voice thinks in populations. It sees the big picture. It's very important, but it wants to keep the system stable. It is the voice of the efficiency, rationality, and health economics. And it's right. Without efficiency and a solidarity-based system collapses. The second voice is the voice of deontology. It sounds different. Warmer, more human, sometimes uncomfortable. And we have a duty to these patients also. Even if they are few, even if the therapy is expensive, justice is not only, it is about dignity and fairness. And this voice thinks in rights, principles, moral boundaries, and it sees individual. It refuses to leave anyone behind. And it's the right as well. Without justice, a system loses its soul. And this is where the true art of HDI and rising reimbursement market access emerges. HDI decisions are never purely technical. They are moral decisions wearing a technical disguise. And we often pretend the ISS qualities and budget impact models are objective, but they are embedded in value judgments. What counts for whom and what costs. And now AI enters the room. AI simplifies the utilitarian voice, I think. It delivers better predictions, faster analysis, clearer models. It shows us what is likely to happen. It makes the system more efficient, and that is good. But AI cannot replace the second voice. It cannot decide what duties we have, what boundaries we draw, and what values we want to protect. AI can tell us what is, but not what ought to be.
Yeah. No, I think that's a that's a good kind of frame. I think just keeping in mind that, let's say, not most, I would guess all of the decisions are having such kind of frames. So I presume, especially in the early planning, I think the input or simulations, scenario planning, whatever you want to call it, can be at least supported by AI and can of course well be done much faster than, let's say, what we as humans can maybe at least do as of now, right? So I think that is of course very important. I mean, if we spin that frame a bit further, how would you see the role of market access managers in maybe 5 to 10 years time, right? I mean, you could as well be thinking about an AI market access manager, or a market access AI manager, or is it just a market access manager and we anyway all use AI for everything we do in this world? I mean, how would you envision that one?
It's a very good question. I never thought about it. But we have to think, how is the role of the market access manager in the future? I think the market access manager is the key person in a company who are responsible for the collaboration between all internal and external decisions making for reimbursements. And he is playing with AI and finding out how we can how the pricing is going on, the reimbursement, national, regional, European, worldwide, and how we can use it for every launch. Yes, I think the market access manager will have another role, must have another role in a company, and he is this is my experience. You have always the collaboration with different stakeholders like GBA, like KBV, like sick funds, healthcare insurance companies. With the politicians, sometimes you have a lot of tasks to bring them together for the decisions making, for the launch, for new drugs, and it's a very for me, it's a very good challenge to positioning the market access in an environment is very fast changing, and the cost pressure in the healthcare system is very, very high. So we need a louder voice in every company to be more present for the launches, and that we can support every other department to make a successful launch for every drug. That's my opinion, and I think you have the declination from the not only the HDI submission. It's very important to have a very good benefit assessment, but there's no pricing there. Very good pricing is not. If you have a good benefit assessment, you have a chance for a better pricing, but it's not. It could be not real that you get the price what you want. And my experience, sometimes I did some launches, and the CEO said to me, I would like to the price is a very high price. Yeah. And I said to him, yeah, fine. I can give you the price. Yeah, we can try it. But if we have the only 3 or 4 patients, then we get the price. Yeah. So this is the past for me. And now we are sometimes in a situation that pricing is not. They have. They think in companies what we have for a new truck is the best one what's ever have. What the patients needs very, very high, but the price is what I very high. The relation between it's a big challenge pricing for me to establish this in a normal expectation to the CEO sometimes, and I need more reality and more transparency in a company for the market access, for reimbursement, and for the HTA submissions. And I worked for a lot of companies in the past, and I see there a very big improvement for market access, and better improvement for AI generally. And so I think we have a big field what we have where we have to work in the future.
Yeah. No, I agree. I mean, the question is, of course, always, let's see, where to include AI and how to best utilize it, and in which environments. I mean, what we do a lot, and I think that's also probably a bit what you said in the very early part of the podcast, is that we use it rather as a challenging partner, right? As somebody who's basically kind of sparring partner, maybe, who is just discussing with us with maybe sometimes even a bit of more and further knowledge than most of humans might be able to have. So otherwise, I mean, market access sounds like a clear frame, but it is very open, very wide, and depends also on the disease area, on the country, and all of the kind of different things, right? And I mean, if you sometimes have even very specific questions and you have an opinion, you can at least challenge yourself with, of course, being critical with the AI, but you can have that kind of challenging, sparring discussion with AI. And that's, I think, where I personally also use it quite a lot to further streamline the idea. Of course, there's still that kind of, let's say, bit, what we have not touched base on, but what we always as well say, we need to have the confidentiality in mind. Of course, we all do not want to have confidential data maybe being uploaded in ChatGPT or Gemini or whatever else. I know that there are some private and commercial available tools and the like, but I think that's, let's say, specific to also the risk assessments within the different industry companies, what they allow and what they do not allow, right? But that's something, of course, keeping in mind. So it's not just simply putting a clinical study report or a result out of the clinical study into such a conversation. It's rather about processes, what I have just been speaking about. The same thing, of course, happens as well when you would want to maybe as well discuss about a potential price or pricing or an outcome of price negotiation. Of course, you can have as well, given AIs, given open or let's say publicly available AI systems as a sparring partner, but you need to as well be a bit cautious, at least as of now, what to use. But having said that, even I think, especially industry companies, or they have already good internal sources, of course, as well. Maybe just going into one last bit, which is the current discussion we all have is or are primarily being driven not only by MFN in the US, but I think it's reference pricing generally. MFN is nothing else than what we all know already since, I would say, centuries within Europe, right? Which is international reference pricing. How do you think AI can streamline such a discussion, or maybe even influence, especially when you would be thinking maybe about global launch sequencing decisions, pricing corridors, and therefore as well different scenario simulations? Because I think that's maybe one of the key parts where that could maybe as well help quite a lot.
This is a very good question, because the launch sequence decisions are a big questions for the global launch strategy. Predictive models I think this is a field from AI. It enables companies to simulate launch sequences across multiple markets, factoring the regulatory timelines and payer requirements, and competitive landscapes. This helps optimize the order and timing of launches to maximize access and revenue. Dynamic scenario planning with AI market access teams can rapidly model the impact of new regulations. For example, GCR, what we have here in Europe, and adjust launch plans in a real time. This agility is increasingly critical as country-level HDI reforms introduce new uncertainties. Yes, because every new drug approval worldwide and launch has a risk for the companies, and you have the chance to show them the pricing corridors with AI-driven price optimization. AI tools analyze global pricing data, reimbursement outcomes, and reference pricing rules to recommend optimal pricing corridors. The differentiations between Europe, US, or in Europe, and the reference prices from Germany, and the impact for the other European countries, for example. This helps companies anticipate price erosions and manage international reference pricing risks, and align launch prices with payer expectations. You have a very good chance for modeling this with AI. And the other one is the regulatory sensitivity. AI can flag risks related to price transparency and cross-border price referencing, especially as US and EU reforms increase scrutiny on launch prices and price differentials. The next thing is the scenario simulations. Multi-market simulations. AI-powered platforms allow complex scenario modeling, simulating the impact of different launch sequences, pricing strategies, and the regulatory changes across markets. This supports evidence-based decisions making and risk mitigation. Policy impact analysis is also AI support can access the downstream effects of new policies, now, for example, US, EU GCI, HDI reforms in different countries on market access. Pricing and reimbursement helping companies proactively adapt strategies, and this very, very fast. Impact of new dynamics. It helps forecast the impact of US price controls on global launch strategies, enabling companies to simulate alternative launch sequences and pricing scenarios to minimize negative effects.
Yeah, perfect. No, I agree. I think the impacts and I think the opportunities, let's say, what AI can bring as well to that field are enormous. I think the important consideration are, of course, let's say, how to really get into those kind of, let's say, details and how to best use and utilize it in order then to frame it. Helmut, I think the time's already gone. So I think there was a lot of different insights, a lot of different, I would say, thoughts, how to also apply it and where to also apply it. I think that's probably also some further pieces where I think everybody and every listener can really get further and deeper into it. So I want to thank you. And of course, happy to continue the discussion also beyond the podcast. Thank you, Helmut.
Yeah, thank you very much, Stefan, for the nice discussion with you. It was a pleasure for me to have the discussion about AI and market access. Thank you very much.
AI beyond hype. That was maybe as well a bit of the question of today's podcast. Key point is probably still that a lot depends on the individual use. A lot depends also on the frameworks of the confidentiality of the security frames which are given within a given industry and or even within a given company. Anyhow, I think what Helmut was clearly laying out, I think, was that AI can be used in a lot of different areas of market access in order to streamline, to save time, and to also make the use of all of our resources, human resources, of course, included, much more efficient. I think ultimately, at least as of now, we're speaking here in 2026, the human needs to be in the loop. I think that's quite clear. Very important as well is what Helmut also mentioned is the sometimes intransparent decision-making by HTA bodies, by payers, which is, of course, and also the kind of question how clear and how certain AI outcomes, for example, in terms of pricing and reimbursement simulations can be taken. So there are some risks, some kind of pitfalls to be taken into consideration, but clear use of AI in market access is recommended. Then finally, the kind of key question is also how does the future look like? I think ultimately the importance of market access managers is already high and will still be at that pace, I would guess, and the role and the work of market access managers might just simply have another tool in the full toolbox, meaning AI, in order to then provide the input and the strategies and the different kind of services and deliverables for the individual tasks which need to be done by market access managers. That was an episode of MAP, the market access podcast provided by Mars Market Access and Pricing Strategy, which is your healthcare consultancy in the German-speaking markets. MAP is available every second week with a new episode, so watch out. And in case you might have questions, contact me directly and or visit our website on www.marketaccess-pricingstrategy.de.